welcome back to our channel. Today we are diving into a topic that affects millions of people around the world, yet remains shrouded in stigma and silence: premature ejaculation and retro-ejaculation. So let's start by understanding the basics. Premature ejaculation is a sexual concern where a man ejaculates sooner than he or his partner would like during sexual activity. This condition can lead to distress, frustration, and potentially relationship problems. On the flip side, we have retro-ejaculation. This is a lesser-known condition where, during ejaculation, semen travels into the bladder instead of exiting through the penis. Now you might be wondering, just how common are these conditions? Well, studies suggest that premature ejaculation affects between 20 to 30% of men at some point in their lives. It's not just an issue for younger men, it can occur at any age. Retro-ejaculation, while less prevalent, can affect men who have certain medical conditions or who have undergone specific surgeries. Understanding the causes of these conditions is the first step towards effective management. Premature ejaculation can be caused by a variety of factors, such as psychological stress, hormonal imbalances, or even certain medical conditions. Retro-ejaculation, on the other hand, can occur due to certain medications, nerve damage, or surgical procedures involving the prostate or bladder neck. Getting a correct diagnosis is crucial for managing these conditions. For both premature ejaculation and retro-ejaculation, doctors may conduct a thorough medical history review, physical examination, and in some cases, specialized tests. Once diagnosed, treatment for premature ejaculation can involve behavioral techniques, counseling, medication, or a combination of these. Retro-ejaculation might require specific medical interventions, such as adjusting medications, or in some cases, surgical procedures. Remember, seeking professional help is a crucial step in managing these conditions. There's absolutely no shame in reaching out. Together, we can break the stigma surrounding these conditions. Let's take a closer look at the epidemiology. Did you know that studies suggest that anywhere between 20 to 30% of men experience premature ejaculation at some point in their lives? That's right. It's a more common issue than most people think. It's a global concern, spanning across continents and cultures. And while it primarily affects younger men, it's not restricted to any particular age group. This condition can make an unwelcome appearance at any stage of a man's life, creating distress and relationship issues. On the other side of the coin, we have retro-ejaculation, a less commonly known but equally important condition. Retro-ejaculation is when semen is redirected to the urinary bladder instead of being expelled through the penis during ejaculation. Unlike premature ejaculation, retro-ejaculation affects a smaller percentage of men, but that doesn't make it any less significant. It is often associated with certain medical conditions or surgeries, making it a more complex issue to tackle. So, what are the implications of these figures? Well, they highlight the importance of understanding and addressing these conditions. They underscore the need for better awareness, more open conversations, and improved access to care. After all, millions of men are navigating these challenges, often in silence. But the good news is, both premature ejaculation and retro-ejaculation are manageable conditions. Understanding the causes is a crucial first step in managing them effectively. For instance, premature ejaculation can stem from a variety of factors, such as psychological issues, hormonal imbalances, or even underlying medical conditions. Retro-ejaculation, on the other hand, can occur due to certain medications, nerve damage, or surgical interventions involving the prostate or bladder neck. It's crucial to identify the root cause in order to provide appropriate treatment. And that's where medical professionals come in. They can offer a range of treatment options, from behavioral techniques to medication, and in some cases, surgery. In the end, it's about breaking the silence and stigma surrounding these conditions. It's about empowering men to seek help when they need it, and reassuring them that these issues are common and treatable. We must remember, there's no shame in seeking help. In fact, it's the bravest thing one can do. Now, understanding the causes is crucial when it comes to managing these conditions effectively. When we talk about premature ejaculation, there are myriad factors that can contribute to its onset. It isn't limited to just one thing. Psychological issues such as anxiety, depression, or stress can play a significant role. The mind and body are intrinsically linked, and emotional well-being can greatly influence sexual health. In addition to mental health, hormonal imbalances can also be a potential cause. The delicate balance of hormones in our body governs a variety of functions, including sexual response. Disruptions within this balance can lead to a myriad of sexual health issues, including premature ejaculation. But it doesn't stop there. Underlying medical conditions, particularly those related to the urinary tract or nervous system, can also contribute to premature ejaculation. It's a complex issue with a complex array of causes. Now shifting gears to retro-ejaculation. This condition is often tied to certain medications, specifically those used to treat mental health disorders or high blood pressure. These medications can inadvertently affect the muscles that control the direction of semen flow during ejaculation. Another common cause is nerve damage, particularly in the pelvic area or spinal cord. These nerves play a crucial role in controlling ejaculation, and damage to them can result in semen being misdirected into the bladder. Lastly, surgical procedures involving the prostate or bladder neck can sometimes lead to retro-ejaculation. These procedures can interfere with the normal functioning of the muscles that control ejaculation, leading to this condition. As you can see, the causes of both premature ejaculation and retro-ejaculation are diverse and multifaceted. Each individual's case is unique, and understanding these causes is the first step in effectively managing these conditions. Now that we have a good grasp of the causes, let's talk about the diagnosis and management of these conditions. Accurate diagnosis is key to effective management. For both premature ejaculation and retro-ejaculation, the first step towards a solution is a thorough medical evaluation. Doctors will typically conduct a comprehensive review of the patient's medical history and carry out a physical examination. In some instances, specialized tests might be needed to ensure a precise diagnosis. The management of premature ejaculation and retro-ejaculation can vary greatly depending on the underlying cause. For premature ejaculation, the treatment plan might include behavioral techniques such as the start-stop method or the squeeze method, both of which involve controlling the urge to ejaculate. Counseling can also be beneficial, particularly if the condition is rooted in psychological factors such as anxiety or relationship issues. In addition, there are medications available which can delay ejaculation. Often, a combination of these approaches yields the best results. In the case of retro-ejaculation, the management strategies are a bit different. If the condition is due to certain medications, an adjustment or change in prescription might be necessary. If it's caused by nerve damage or surgical interventions involving the prostate or bladder neck, further medical or surgical treatments might be required. It's also worth noting that retro-ejaculation doesn't typically require treatment unless fertility is a concern. Regardless of the condition, it's crucial to have an open and honest conversation with your healthcare provider. They can guide you towards the most effective treatment plan tailored to your unique situation. Remember, sexual health is a vital aspect of overall well-being. It's completely normal to seek professional help when facing issues in this area. Whether you're personally affected by premature ejaculation or retro-ejaculation, or you're supporting someone who is, reaching out to a healthcare professional can make a world of difference. It's important to remember that seeking professional help, whether you're personally affected or supporting someone who is, can make a world of difference. Remember, you are not alone in this journey. Addressing sexual health concerns, such as premature or retro-ejaculation, might seem daunting, but it's essential to remember that there are countless people around the world who share similar experiences. The first step towards managing these conditions is recognizing that they are indeed common, and more importantly, treatable. It's time we break the silence and shatter the stigma that surrounds these topics. Stigma often stems from a lack of understanding, which is why education plays such a crucial role. By expanding our knowledge, we empower ourselves and others to foster open, honest conversations about sexual health. This openness not only lifts the burden of isolation, but also paves the way for more comprehensive and effective treatment strategies. If you or someone you know is affected by premature or retro-ejaculation, seeking professional help is a crucial step forward. there's no shame in reaching out to healthcare professionals who have the knowledge and resources to provide the right kind of assistance. They can help you understand your condition, explore potential causes, and guide you towards the most appropriate treatment options. Support isn't limited to professionals, though. Connecting with others who share similar experiences can be incredibly therapeutic. Whether it's through online forums, local support groups, or even open conversations with friends, sharing your journey can provide a sense of camaraderie and mutual understanding. While we've delved into the epidemiology, causes, diagnosis, and management of premature and retro-ejaculation today, it's crucial to remember that this is just the tip of the iceberg. There's so much more to learn and understand. So let's keep the conversation going, let's keep learning, and let's keep breaking down barriers. Thank you for joining us on this enlightening exploration of premature and retro-ejaculation. Together, we can break the stigma and foster a society that's open, informed, and supportive when it comes to sexual health.